activated version?
12-502.
That is correct, sir. So have you ever had biofeedback before?
Mm-mm.
So biofeedback is a machine that we use to help with activating muscles and relaxing muscles. And because you had a stroke, all right, your muscle here, your bicep muscle, it's too strong, and your triceps are not strong enough. So we're going to try to relax your bicep and activate your tricep. Okay? Now, in order to do this, I just need to ask you a couple of questions, okay? Tell me today what your pain is on a scale of 0 to 10, 0 being no pain, 10, let's go to the ER right now.
3.
Okay, so not too bad. What happens like when you contract or stretch this muscle? Do you have any issues with increased pain there, or unable to do that?
That's when I bring it up.
Okay, but not to that 10 level of pain. Okay, so no contrast, which would be he's unable to have a muscle contraction comfortably. Okay, we don't have to worry about any of those contrasts to ease him because we're not hooking him up to any type of current. Okay, so all our pre-assessments are going to be the same. All right, we still want to do a dermatome test of the area. So for him, we're going to test C5 all the way to T1, T2 area on both sides. Let me reiterate, you always start with the unaffected side, then affected side, and then together, okay? Because you want the unaffected side to represent the norm, all right? Because if you do the affected side first, then you're not really sure if their response is what it should be compared to what you're doing on that unaffected, okay? Range of motion we would do with ergonometric testing, definitely looking at elbow flexion, elbow extension, because that's where the issue is that we're testing. Manual muscle testing for the flexors and the extensors. We would do circumferential if there was any swelling. There's no wound. If so, we would do a wound assessment. And we would definitely want to palpate and check our skin for the biceps area and also the triceps, all right? If we had a 2-channel system, we could set it up where he would work on relaxing this one, followed by an activation of this one. So we could set it up asynchronous. So relax, contract, relax, contract. In the clinic, you're going to have those and even higher quality biofeedback machines that will allow you to do that, all right? We don't with this particular one. The MyoTrack one does, so we would be able to do that more effectively on the MyoTrack. But with this particular pathway one, we would actually want to set up the electrode at the muscle belly parallel to the muscle fibers. Remember, we're not trying to stimulate the neuromuscular junction because there is no current. We're just trying to recruit muscle fibers, okay? So I want you to try to contract this bicep, and I'm going to go right on top of there, and you can see that, okay? If it's not sticking, you might have to hold it for the demo, thanks. Okay, so what I'm trying to do is set him up so his goal will be to activate the muscle. So for now, we'll start with relaxation. I would position him better, of course, if I was doing sitting in a chair with the arms, pillow behind him, draped if necessary, or I could set him up in supine on the plinth. So I'm going to turn this on, okay, and I want to set it up where I want him to reach a certain goal, okay. So let's say I want him to be, I'm going to set up my audio to be continuous when he hits the goal. All right, so relax. Now contract the muscle. When he hits the goal, he's going to get the ba-ba-ba-ba-ba-ba-ba. Now relax. Now go again. That's it, okay? Now, if I wanted to set him up on the tricep, so I want him to activate this tricep. You can hold it. Probably going to set him up more in a prone position and have him go. If it's really weak, you better go gravity eliminated in the beginning because he can't go against gravity. So in your manual muscle testing, what would he need to have as a grade to set him up against gravity? 3.
Oh, 3, that's right.
So if he's a 2, how will you position him? It's going to have to be in a gravity eliminated position. So you're going to have to think through these things. There might be questions on this test next week that says, what position would you put your patient in if the manual muscle testing for the triceps was a grade of 2 or a grade of 4? So then it would be against gravity for the 4, gravity eliminated in the 2. Okay, so we're trying to get him, and our goal is going to be rest. Okay, so we'll set this up for rest. Okay, and we want to make this where when it rests, it's going to go off. Okay, so, or no, we can make it where it goes like that. Okay, so now contract it and rest it. Contract it and rest it. Okay, so see how I'm saying you can do whatever is best for your patient? If he hates the noise, when he reaches the goal, it'll go off. If it's it's okay. If it's a motivator, you set it up where it goes off. Okay? Now, this machine does biofeedback as well as we've got a couple of the Myotracks that do it as well, and they're set up the same way. So you would set it up, and as you turn it up, when they contract, it'll go towards the green, and you can set it up on audio to go ding, ding, ding. If you want them to relax, you can have it where you can ding, ding, ding it, or it can take it off the dings. Okay, very simple. So all I want you to do between now and next Wednesday is to work through the checkoff and know how to set it up to relax a muscle, set it up to activate a muscle. That's all you have to do for your skills checkoff and biofeedback. So hyperstim on Stan, pimples, the one in the middle of that trolley. Make sure that everybody does at least 3 points of stimulation with Stan, and everybody needs to feel that stim except for Allie, okay? Because you need to be able to describe it to your patients. And then everybody needs to get a check off using either the Myotrack or the Pathway one, okay? Now you can play around with this one and it picks up heart rate, skin temperature, things like that, but you don't have to use this for your check off. You can just check it out. All right? Okay, so that's all you have to do for electro between now and Wednesday. The check off on hyperstim and a check off on biofeedback. Your biofeedback assignment is also due next Wednesday. You have the prompt to do that. You need to make sure that it's very thorough and that you put it in terms where you can teach your patient how to use it, and make sure you reference any research things that you pull up about it, okay? Be creative, think outside the box. We know there are lots that pick up muscle contractions, relaxation, heart rate, but there's also the ones on the peripheral skin temperature that decreases stress levels, things like that. Those are pretty cool. So find something really neat and finish that assignment.